So this is my informative speech. Here's my audience. All right. So picture this. The tones go off. You're dispatched to the home of an individual where CPR is being performed by a bystander. And as you approach the scene, you notice that inadequate CPR is being performed by the bystander. And they also inform you that they have not breathed for the patient yet. When you take over the scene, get the patient to the hospital, the patient does end up dying, and the bystander was a little concerned that they could have done something better to improve the outcome of the patient. And I'm here to just shed a little bit of light on kind of the anatomy and physiology of CPR, some of the misconceptions with CPR, and what the standard of care is now. So to begin, this information comes from the U.S. National Library of Medicine, which simply states that all organs need oxygen to survive. 3 body systems work together to make sure that the organs and the rest of the system have adequate oxygen. That is the cardiovascular system, respiratory system, and the nervous system. Now these 3 systems work together to maintain life. The lungs pull in oxygen, and the cardiovascular system distributes it throughout the body. And when one of these systems fail, the process of dying begins. The miracle of CPR is that it can be life-saving to a person with 2 simple actions: delivering breath to the victim's lungs and compressing the victim's chest. Now, there are a few misconceptions with CPR, and one is that that it always works, which is not true, unfortunately. According to the AHA, American Heart Association, only 2 to 15% of patients who have CPR performed on them outside of the hospital actually survive. There are a few other injuries that could be occurred with CPR, and that is rib fractures, sternal fractures, and that happens about 75% of the time. Now these injuries could require further intervention, usually only about 0.5% of them, but treating them, these injuries by themselves are not life-threatening. Even though these injuries do happen, it is not a reason to try and go easy on the patient. The AHA guidelines are to go hard and fast. Now, in 2010, the ECC released its newest guidelines for CPR. The initial steps were ABC, airway breathing circulation. Now they are CAB, circulation airway breathing. The look, listen, and feel is also no longer recommended. They just recommend that you feel for a pulse for no longer than 10 seconds before beginning CPR. And stopping CPR to give 2 breaths is also no longer recommended. The organization is wanting to get a minimum of 100 compressions a minute, and it takes an initial 30 compressions just to prime the heart to get the blood circulating through the body. So, there's so much that can be said and found on CPR. There's a lot that you can research to find out about it, and it's kind of hard to fit that all here into a 3-minute speech. But the main points I want to leave you with today is just knowing that a majority of bystanders who perform CPR are friends and family, and you'll never know when you'll be called upon to do CPR. So just know that breathing is not as important as chest compressions, and that there may be some rib breaking and other type of injuries that could occur from it, but just keep compressions going until help can arrive. Doing fast and hard compressions will give them the best chance of survival.